if you are going to a mental health treatment program, whether it's getting meds from a psychiatrist or whether it is getting tested for diagnosis by or for symptoms by a psychologist, or you are dealing with treatment by a therapist, such as cognitive behavioral therapy or dialectal. One of the things you want to pay attention to is, given that that's the treatment that I'm receiving as a patient, and you want to clarify this with your doctor, is that treatment evidence-based? But even more so than just having an evidence-based treatment, you have to ask yourself, is that treatment statistically significant? So what statistically significant means is that, given the field of statistics, any such evidentiary-based study that, or for any given method of treatment, that method is only effective or works for you if the results from that study show that it was statistically significant by being greater in its outcome by 50% or larger. Now, that's interesting because if that margin goes below 50% as far as the results of that evidentiary study, you run into a problem where malpractice can happen, because if someone is using an unproven method to treat someone who has some type of mental illness or any type of illness, it can cause more problems than good. Now, one example of this, one example of an area of therapy that does not have much empirical evidence is Freudian psychoanalysis, or at least it used to be that way. But take, for instance, something like CBT, where they have shown through brain scans that CBT does actually have an impact that can change the way that we think, or the way that our brain activity behaves, or the areas in which that activity is exhibited. So you want to make sure that whatever therapy you're going to, you're not getting somebody who's essentially a crackpot.